Osteosarcoma is a type of bone cancer that typically originates in the osteoblasts, the cells responsible for bone formation. It is the most common primary malignant bone tumor in children and young adults, particularly affecting those between the ages of 10 and 20. Osteosarcoma usually occurs in the long bones, such as the arms and legs, but can also develop in other bones. Causes and risk factors. The exact cause of osteosarcoma is unknown, but several risk factors have been identified. Age. Osteosarcoma most commonly affects adolescents and young adults, particularly during periods of rapid bone growth. Gender. It is slightly more common in males than in females. Genetic factors. Certain genetic conditions increase the risk of developing osteosarcoma, including Li-Fraumeni syndrome, a hereditary disorder that increases the risk of various cancers. Retinoblastoma, a childhood eye cancer, can be associated with an increased risk of osteosarcoma. Hatchett's disease, a condition that leads to abnormal bone growth, may increase the risk in older adults. Previous radiation therapy. Individuals who have undergone radiation treatment for other cancers may have an increased risk of developing osteosarcoma. Bone disorders. Conditions that affect bone structure and health, such as osteogenesis imperfecta, may increase risk. Symptoms of osteosarcoma can vary, but common signs include pain, persistent pain in the affected bone, which may worsen with activity and improve with rest. Swelling or a noticeable mass near the affected area, which may not be painful initially. Limited range of motion, difficulty moving the affected limb, especially if the tumor is near a joint. Fractures, increased susceptibility to fractures in the affected bone due to weakening. Fatigue and unexplained weight loss. General symptoms may occur, especially as the disease progresses. Diagnosis. Diagnosing osteosarcoma typically involves several steps. Medical history and physical examination. Healthcare provider will gather information about symptoms, medical history, and perform a physical exam to assess the affected area. Imaging tests. X-rays, the initial imaging method to evaluate the bone for abnormalities. CT scans, to assess the extent of the disease and check for metastasis. MRI, provides detailed images of the tumor and surrounding soft tissues, helping to determine the best treatment approach. Bone scintigraphy. Bones may be used to identify any spread of the cancer to other bones. Biopsy. The definitive diagnosis is made through a biopsy, where a sample of the tumor is obtained and examined microscopically to confirm the presence of cancer cells. There are different types of biopsies. Needle biopsy involves inserting the needle to extract tissue. Surgical biopsy, the more invasive procedure where a larger sample is taken. Blood tests. While no specific blood test can diagnose osteosarcoma, blood tests may be performed to assess overall health and organ function. Staging. Osteosarcoma is classified into different stages based on the size of the tumor and whether it has spread to nearby lymph nodes or distant sites. Localized osteosarcoma. The tumor is confined to the bone and has not spread to other parts of the body. Metastatic osteosarcoma. The cancer has spread to other bones or organs, commonly the lungs. Treatment for osteosarcoma typically involves a multidisciplinary approach and may include surgery. The primary treatment for osteosarcoma is surgical removal of the tumor. The goal is to remove the tumor along with a margin of healthy tissue. Depending on the location and extent of the tumor, options include limb salvage surgery, removing the tumor while preserving a limb. Amputation, in cases where limb salvage is not feasible. Chemotherapy. Chemotherapy is often used before neoadjuvant and after adjuvant surgery to shrink the tumor and kill any remaining cancer cells. Commonly used drugs include doxorubicin, methotrexate, cisplatin in radiation therapy. While not typically the primary treatment for osteosarcoma, radiation may be used in certain cases, especially if surgery is not an option or for palliative care. Targeted therapy. Research is ongoing into targeted therapies that focus on specific cancer cell characteristics. Prognosis. The prognosis for osteosarcoma varies based on several factors, including stage of the disease. Localized osteosarcoma generally has a better prognosis than metastatic disease. Response to treatment. The significant reduction in tumor size following preoperative chemotherapy is often associated with a better outcome. Location of the tumor. Tumors located in certain areas may be more challenging to treat effectively. Overall, the 5-year survival rate for localized osteosarcoma is approximately 60 to 80%, while for metastatic osteosarcoma, the rate can be significantly lower. Follow-up care. Long-term follow-up is essential for individuals who have been treated for osteosarcoma. This may include regular physical examinations, imaging studies to monitor for recurrence, rehabilitation and support services to address any physical or emotional challenges. Conclusion. Osteosarcoma is a serious and aggressive bone cancer that primarily affects adolescents and young adults. Early detection and comprehensive treatment approach are crucial for improving outcomes. Research into new treatment options and supportive care continues, providing hope for those affected by this challenging disease. Regular follow-up and supportive care are vital for managing long-term health and quality of life after treatment.